Well, thank you, Bob. We're on to the next panel on time. Thank you very much, Bob, for that great discussion on the policy and the policy side. Good afternoon and welcome, everyone. This panel that we're going to be shortly starting would be looking at the cross-industry look at education need panel. I'm Farad Vazagu, Director of Advanced Technology Program and Workforce Development, MassTech. On the panel today, we have representatives from healthcare and financial sector, which should provide a different perspective on the panel topic. It is my honor and privilege to introduce my panelists. So with that, I'm going to introduce first Joanne Pokaski, Senior Director of Workforce Development and Community Relations, Beth Israel Deaconess Medical Center. Under Joanne's leadership, BIDMC has launched many pipeline programs that sponsor employees' training and promotion to hard-to-fill occupations. We'll have to talk about what those occupations are. In the past, she has worked at Boston Redevelopment Authority, the Clinton White House, and as a special assistant to the administrator of the Medicare and Medicaid program during the Clinton administration. Welcome, Joanne. Our second panel is Jessica Beakley. I'm sure, I hope I'm pronouncing it correctly now. Oh, very good. I'm getting the thumbs up. Leads the learning and development at Pittsburgh-based UPMC. UPMC is the largest non-governmental employer in Pennsylvania that integrates more than 90,000 employees, 40 hospitals, 800 doctors' offices and outpatient sites, and a more than 4 million member insurance service division. This is the largest medical insurance in Western Pennsylvania. Wow, okay. UPMC learning and development designs and delivers innovative learning opportunity for staff, leaders, and physicians. Jessica is passionate about improving the employee community, healthcare and health plan member, and patient experience. Welcome, Jessica, and thank you. Our final panelist is James Flynn. He's the Assistant Director of Research Business Development at UMass Amherst College of Information and Computer Sciences. Before working in higher education, Jim started, built, and sold companies in fintech and online media. He also held leadership roles in the corporate world, working as CEO of Pitney Bowes Dachshunds and as the EVP and CEO of Ellipsis Technology. Welcome, Jim. All right, so with that introduction over, let's get started. The first topic I'm going to engage our panelists is on how do we secure and what is the mechanism by which we securing middle-level skilled employees. This problem is described by many as a chronic problem that employers face. The problem is characterized as the gap really between what is required versus what is needed by the job. So the skills gap is really the focus of the attention here. So I'm going to come to you first, Joanne. What has been your experience with hiring mid-level skilled employees? Can you comment on the gap between required skills versus what is needed for the jobs you're hiring at BIDMC?
Sure. So in healthcare, we need people with very specific skills and credentials. And often the market is not producing enough people to meet our need, or producing folks with skills that don't quite match what we're looking for. So at Beth Israel Deaconess Medical Center in Boston, where I work, we've tried to proactively bridge that gap through what we call pipeline programs that train our employees up into jobs we're having trouble filling. So I'll give you an example of that. We competitively select each year employees and sponsor them through a year-long training program at Bunker Hill Community College to become central processing technicians. These are folks who sterilize our equipment and are experts at sterilization. So we cover the cost of the training. We provide a clinical practicum schedule that works with their work schedule, and we guarantee them a job at the end if they're successful completers. So, at the end, they sort of move to a new job that's a higher skilled job with better pay and, a multi-rung career ladder. And we have great employees who've been wonderful at their last job and who are now stepping into a new job where they're going to learn even more and be more successful and earn more money with us. So another example is that we offer a 3-week paid training to the patient care technician role, which is like an acute care CNA. So if people have direct care experience or a CNA, we select them and then do a 3-week paid training to make sure they're comfortable in our acute care environment. And we have a great amount of success after this 3-week training in retaining people into this role because they really understand the environment and they've been supported through. We also have trained people to be medical laboratory technicians, working with Bunker Hill Community College. We've trained folks to be research administrators, pharmacy technicians, and medical coders. In our selection process, we look for people who are successful in their current role and have the baseline skills, math, reading, English, that they need for whatever training we're doing. We also interview people together with hiring managers to make sure they're going to be the right fit for the job and that they understand the responsibilities of the job. We will have some great employees who won't be academically ready for that training at the time. And those folks get referred to our career and academic advisor, who connects them with free ESOL classes we offer on site, free math, reading, and English courses we offer on site for our employees, so that the next time an opportunity comes around, they're ready. So one advantage we have as a hospital is our scale. We have 12,000 employees. So I can market to a lot of people about an opportunity and get the scale of candidates that I need to run a program. And I think one lesson that other industries can take from us is to identify hard to fill roles and market them as opportunities to your incumbent workers. We have so many in healthcare, so many niche jobs that no one knows about but people in healthcare. But these are the ideal people to think about moving up and taking the next step in their careers. And I think we have a sweet spot to offer career mobility to people who have a high school diploma but never got a college degree. We can help guide them to a higher skilled, better paying job, often through a short-term training. And then I will just say one group I think that's been harder for us and other hospitals to work with is people who don't yet have a high school diploma. And that can be a longer road to get that high school diploma to then move on to other things. So that's a little bit about what we do, and I'm happy to talk about it more.
Sure. This what you just said is I have a couple of questions right away on this.
Okay.
I want to engage you on. One is how did the IDMC come up with this program? I mean, what led you to this space in the first place? I'm sure it didn't come overnight. This must have been your experience over time. And either the education that was being delivered outside wasn't adequate or it wasn't enough. So what led you to, how did you get there to this space?
So I was brought in from a new head of HR at BIDMC who said, I see some other employers starting to do this, really training people up to jobs they're having trouble filling. And I'm hearing over and over again how many jobs we're having trouble filling. How do we train our own employees up into these jobs so nobody has a dead end job here? And how do we think about this? So I was brought in to implement her vision at the time.
And when the prospective sort of employees come through the door, how do you market it to them? Or I mean, is this one of the selling points of the job? It's got to be, because if you're doing all of this and it's free, and it can't be bad.
Yeah, I mean, we try to market early. Your first day at work, you've got a lot going on. And so, you're thinking about how are you going to be successful in the job you were hired for. So we do mention it at orientation, but one of the things we do is about 6 months later, we send every new employee an email saying, now let's start talking about your career. And here are all the opportunities that we offer. And so connect with us and, we'll keep you posted on what's happening with us.
And then is this there are any ties in terms of, if you go on a training, your basically starting salary would be increased by the training that you get? Is there compensation adjustment during this phase at all?
So usually the compensation adjustment is at the end when you're fully trained to the new role. And we are very open about, you're making this right now, in the new job, you will make this. So we don't want somebody starting a job and training downwards, right? We want everybody to move up. So we try to be very transparent about, okay, right now you make this. When you finish this training, this is what you'll make. So we try to have those conversations up front and making sure people are continuing to move up in their salary trajectory.
Very good. Thank you. It's fascinating to hear all the efforts that are going on at BATMC, and it's very much in line really with the quite a few of the tenants of the MassBridge. So we'd love to compare notes here and see what we can learn from. I'm sure plenty.
Sounds good.
So I'm going to come to you, Jim, next. What you're hearing from your research. You've been in the fintech business, and it's being a lot of research in this area. Do you see any parallels between what just Joanne described and what has been your experience? Does businesses see this challenge differently? Are there any lessons learned? Just a few questions here.
Sure. Where do I start? Well, being in higher ed, we're more on the end where we're trying to train people and prepare them for the workforce. But as you mentioned, there is a lot of research that we've done in this area, and one in particular I'd like to highlight is we did some extensive research with one of our industry partners, Stanley Black & Decker, looking at manufacturing employees and seeing how we can take them and retrain them for more up-to-date jobs, higher paying jobs. And so we actually worked with them to do a number of surveys of their employees, and really hundreds of them. I think the average age was 47, looking for what skill sets they want to learn, and where's the greatest potential, where's the needs for these types of people. So when you have the average age of 47, they're in many cases they're how to interface with, say, robotics. It's not something that they learned in school, and even now is not something that's typically taught in school for doing that. In many cases, some of these people were not familiar with computers, but we did find the universal aspect was that they were familiar with smartphones. So we developed for them a mobile interface using AI to how to train them on the job, so to speak. So whether they're using machine and robotics to be able to have an AI system that both monitors the set to calibrated to the skill level of the employee, the background and the capabilities, as well as the productivity of the robot that they were using. And so, to back up a little bit, we did find that there was some of the findings that we did find out is that there was a strong preference for online learning, as well as a preference for part-time versus full-time. And one interesting aspect we did find is that they were very interested in, they were less interested in getting the job with the highest pay, but they were quite sensitive to jobs that would potentially be automated out of existence. So they would actually take a lower paying job if they felt that that was more secure. So we actually implemented this AI system to train them while they're using a system. And you might be interfacing with a robot, and what happens when you need to restart the user interface for the robot? What happens when there's a vibration situation, or when the robot does something wrong, in order to fix that? So we found that that was very useful in terms of being able to retrain factory workers, manufacturing workers, to without having to have another human being there all the time monitoring them. And as the skill level increased, as they got better and better at doing their job, the system would more focus on increasing the productivity of the robot. So there was, we have done a significant amount of research in this area, and we did learn a lot of things in terms of the challenges of being able to retrain people for more up-to-date, higher-paying jobs.
You mentioned AR, VR. How prevalent is the use of it in the research you've done in the business arena? Is it being used at all, or how is it being used?
You mean AR, VR?
Yeah.
We actually weren't using virtual reality in these trainings. It was more, we did have a mobile interface, in which case we would actually simulate the working of the robot, to be able to see how it's supposed to work. but a little bit less sophisticated than a full immersive virtual reality environment. And although that would of course be interesting, it would probably be a more significant endeavor to actually create that.
Thank you. So Jessica, I'm going to come to you. With UPMC being the largest employer, as you described up in my opening about the introduction I was giving for you in Pennsylvania, you are hiring across many disciplines, I'm sure. And do you see those skill gaps as a big issue? If it is, what are some of your solutions and learnings that you have in place?
Absolutely. And I echo many of the things that Joanne and Jim have already shared in terms of great approaches. It's nice to hear some confirmation that we may be on the right track with some of these approaches. I think a few things have been helpful for us in looking at not only skill gaps potentially, but even stepping back to really take a look at the roles that exist in our organization and the requirements of those roles that we have sort of self-imposed. And I think this has been really critically important now more than ever to ensure that the jobs that we have really clear expectations and set requirements for them that in particular aren't creating barriers to employment or to growth within the organization, both for our great employees and those coming into the organization, and for us to ensure that we're filling those very critical roles that exist and creating opportunities for continued growth. So something that we've been doing is taking a look at, does this job really require the level of education that we historically have required for it? And if so, then we confirm that. If not, we're allowing much more equivalency of experience to come into play to ensure that we're right-sizing our own career pathways and the talent within our organization, and providing additional education or time frame to complete education to continue to grow within those pathways. So that's been something that's been important to us to take a look at and assess. I think where we have those skilled employees as well, again, defining maybe some of those timeframes where they have to obtain necessary education or credentials for those positions and supporting them in doing so. Something else that we've done is to identify what we're calling skill sets of the future, and a little bit of terming that future as now, right? There is no greater time than now to be ensuring that we are equipping our employees to be successful in ways that work has changed and will continue to evolve and change. And I don't think that the skills that we've identified so much are new skills, but I think the need to leverage them in different ways has presented itself. And so focusing on things like emotional intelligence and critical thinking and problem solving, creativity and originality and innovation, and really serving up learning pathways to our employees to be able to focus on the skills that they identify as most needed in partnership with their leaders as well. And so we balance these things both between self-paced learning that the employee can access when they are able to, and also through instructor-led opportunities, again, that they can leverage when they are able to. I think another element that has been helpful to us is looking at workforce development and community partnerships. And so for UPMC in particular, although we are Pittsburgh, Pennsylvania headquartered, we have presence all across the state. And so community means different things in those different geographic regions. And we certainly extend beyond the state of Pennsylvania at this point. And so we, like Joanne shared, have created some opportunities with community partnerships for paid training programs to develop pipelines into the organization. So particularly for underrepresented populations that have faced barriers to employment or to development. So we've created accelerated programs for things like Joanne shared related to patient care technicians. And we have a program that is 10 weeks long that trains individuals on how to be emergency responders. And that comes with guarantees at the end of those paid programs that you will at minimum have an interview, or you will be routed directly into a regular full-time position. And these are allowing us to meet the great needs that we have in identifying strong employees and talented employees, while also ensuring that we're creating opportunities for our community. So those are a few things that we've been focused on to ensure that we are building great pipelines and also upskilling our existing employees.
Well, fantastic. I mean, if I told you that you weren't part of our MassBridge program, nobody would believe this. So these are all the elements that you're talking about is precisely we're looking at. One thing that you said, something that piqued my interest, you talked about skill set of the future. So how did you, and I'm going to come to the other panelists with this same question, how did you arrive at the skill set of the future? What, is future tomorrow? Is future 2 years from now? How is it evolving?
I feel like it was almost yesterday, right? That's a bit, I think all of us may feel as we look at what those needs are. And I do think what was striking for me, I mean, so for us, we did, a typical needs assessment in any way. We looked at our own organization and the greatest needs that we see exist in terms of those skills. We looked externally to see where do we see those trends, and now to a year from now, what are going to be the skill sets that are needed to be successful, and that's really where we landed on kind of honing in and focusing on these kind of overarching skills. And what was interesting for us, I think traditionally they're viewed as those soft skills more so. But I think many of us view them as the real skills that help people to be very successful in their careers. And what was interesting is that we didn't see too much differentiation between an individual contributor and what is needed for our leaders necessarily. A bit of how they approach and use the skills and leverage them in their positions. But I think we found more so this overarching need for these types of skills to be successful.
Jim, what do you think of these soft skills? Every time, in business environment, I'm sure nobody wants to be labeled as soft skills. What do you think of these skills and how does that resonate?
I guess when you're talking about soft skills, are you talking about things like networking capabilities or? It's
just core competencies that allow you to be a productive person or productive employee. I mean, soft skills, how to communicate, how to present, how to listen.
Yeah, I mean, I think particularly in any technology field or business field, that those soft skills are, maybe really, really important. And recently involved in a program where we were teaching fintech to a group of Boston Public high school graduates, and much of what we spent a lot of time on were things like soft skills. And these are students from underrepresented groups, from low-income households, just to teach them how to build a network is something that speaker after speaker that we brought in, and we tried to bring in people who would be really good role models, just couldn't emphasize that enough, is being able to build those things like networks and being able to understand the language of business that of the world that they're entering into. So yeah, I mean, I'm a big fan of soft skills.
Good. So Joanne, do you want to add your comment to that, or everything is explained here?
I would just add, as you talk about skills of the future, clearly digital and virtual skills are high on the list now. And then for us, I think about lifelong learning and openness to change. So, how we do healthcare hasn't changed dramatically, but we're always trying to think about how can we do this more effectively? Let's try this. Are we going to huddle? Are we going to do this? So being open to different ways and different processes, because we're always trying new things to sort of maximize the experience of the patient. I think those are really important.
Very good. That's great. I want to remind the audience that you can input your questions through using the Q&A chat button. So if you have any questions, we definitely would be interested to hear from you. So I'm going to switch topics a little bit here and go after something that actually George mentioned for those of you who actually were at the beginning of the conference. George mentioned about the disparity between sort of 4-year colleges and 2-year colleges. And so it looks to me that a lot of the jobs for, it's clear that not all the jobs require a 4-year college degree. But hiring practices, and I'm not saying that the hiring practices of your particular companies or institution that you're representing, but still entrenched in emphasizing a 4-year degree. Even though they're using a 4-year degree, you bring somebody on and you put them on a job, and then that person says, well, this is not in line with my education, and they move on. So what I would like to hear is, from you folks as to what is going on in here. Is this practice still is as pervasive as it was before, or have it changed in that? So Jessica, I'm going to come to you first. Sorry to put you on the spot first, but.
No, that's okay. I think currently our practices are pretty similar to how they have always been in terms of campus recruitment and connection with those 4-year universities, particularly on our more professional categorized roles. I think, as I've shared with our focus on looking at equivalency in terms of experience and that opening the door to more associate's degrees or high school GED types of roles with experience equivalency, I think it will change some of that recruitment process even more into the future. So I envision those partnerships with community colleges and other non-4-year universities becoming even greater. But I think we have also found some unique opportunities to partner with those organizations, those academic institutions today, in particular with leveraging our total rewards with our employees, particularly our tuition benefit, and creating a really clear employee value proposition to them. So for example, we have partnerships with organizations where our employees, and we have really focused on marketing these opportunities to our employees for awareness, because I think in the absence of knowing they exist, they're not as helpful, certainly. For a nurse who wants to go back to get her BSN and continue to progress through her career ladder, that we are able to leverage our tuition benefit with certain academic institutions, that they don't encounter any upfront out-of-pocket cost to do that. So again, we're trying to reduce some of those barriers that have existed and create more accessibility. Another is we have partnered, so my own team in learning and development that delivers leadership development courses has partnered with Robert Morris University to co-deliver a leadership and organizational change certificate. So it is an effort that both drives employees to take advantage of our internal growth and development opportunities for academic credit, and obtain also coursework from faculty at this 4-year institution that allows them to obtain a certificate that at the end is 1/3 of the way through a master's degree, again, at no upfront cost to them, with their own leader supporting them and stepping away from their work time to pursue these leadership development courses. And again, no out-of-pocket cost to them up front. And so these are partnerships that I think we're going to see more and more with those types of academic institutions, where everyone is really benefiting from this approach and this shared delivery model. So that's something that I'm excited about, and I do think we're going to continue to see a bit more of as we go forward.
Great. Jim, I'm going to turn to you. Do you see, is the financial sector, IT, fintech, different in this regard? What do you think of the role of two-year colleges play in preparing the workforce? And how do you think about the skills best taught by or hired from community colleges versus other institutional education systems? You're on mute.
How about now? Okay. I actually haven't seen a ton of activity in that area. However, in my basically fintech career, I've worked with a lot of financial service companies in Europe, and I think there might be an opportunity for something similar to, say, the apprentice system that they have in Germany, where you don't necessarily need a university degree for every type of job. They mostly focus on the skill sets you need for that particular thing, and that may be a role where two-year college, community colleges could play more of a role in preparing people that way. I don't think every job needs a 4-year degree, but I thought with the pandemic that we'd see a lot of changes in that area, but it doesn't seem, from where I sit, it doesn't seem to really be happening. There's still a big focus on 4-year degrees.
Joanne, I guess the question that I want to ask is the same question, but it looks to me that when you opened up the first question, you were offering, BIDMC is offering so many programs and opportunities for folks to sort of extend their education, if you will. So I feel kind of this probably question doesn't apply, but I'm going to ask anyway. So what is your thought in this area?
I think I want to tell you a story about a program that we just piloted, because it's a perfect example of this. So about 10 years ago, we made the decision to only hire nurses trained at the bachelor's degree level. And this was at a time there were a lot of national studies coming out saying that sort of having more BSN trained nurses was better for patient outcomes. So, we did that. And then, recently, as we've become more intentional around diversity and inclusion, we realized that our nurse workforce was not reflecting the community that we serve. And we wanted to hire more diverse nurses, but we were competing, and unsuccessfully, with other hospitals for the limited number of diverse BSN trained nurses. So we had to think differently about getting a different workforce. And so one thing we launched was our nurse residency program. So we hire some nurses at the associate degree level, and we give them a 2-year orientation as we sponsor them to get their bachelor's in nursing. So the expectation is everybody's going to get to the bachelor's degree, but we found a different path for people to get there. So we market the opportunity to new grads at community colleges, and we're graduating our first cohort this week with another cohort already started. So we're hoping this is a good way to kind of bring in folks who might not otherwise come and work for us, support them in getting to their bachelor's degree, and diversify our nurse workforce.
Very good. I got a couple of questions that come through the chat here. I'm gonna sort of put them out there for you folks to chime in. And the first question is, given human skills are so important, what do you see as the unmet needs in developing your workforce human skills, if any? So Jessica, any comment on that?
Absolutely. And I think that I see a greater need more than ever for, as I mentioned, emotional intelligence. And I think also where creativity and originality, those skills that I mentioned earlier too, I don't think we've ever traditionally thought of those as necessary skills to be successful And I think it's combining some of these skills that I've laid out: emotional intelligence, the way that we think critically, and are creative in finding our solutions and applying them are going to be the keys to success into the future. And so some of those kind of tenets of what those successful skills look like, I think, have shifted. And not only that, but have to be leveraged in this new world that we are functioning in, kind of coming out of COVID. And I think that is what is unmet currently, as well as how we can support individuals in continuing to adapt and to be resilient, because those things look different today than they did before. And resilience isn't just about perseverance. It's not just about seeing your way, toughening up and moving through it. I think that the elements of self-care and in all of the ways that we need to care for ourselves while caring for others, our teams, those we serve, customers, these are going to be the real skill sets that we need to continue to meet in a different way than we may have before.
Anybody else wants to chime in on this?
I'll just add, I think there's a role for managers to play here. So I think, an employee needs to be aware of their own soft skills, and a manager can give a lot of great feedback around soft skills. And then the third actor is, how can the organization support the manager in some trainings or ways of talking to the employee around their soft skills. So I think there's a real role for the manager-employee relationship in developing these skills.
And I would just definitely dovetail off what Jessica was saying about creativity. If you're looking at positions that will be automated out of existence, probably the last ones that'll happen to would be the highly creative ones. I mean, you could have a computer compose a song, but it's not very good at this point. But if you could have human beings that are creative, we're developing AI bots that replace lawyers and replace financial advisors. But novelists will probably be the last in line for being replaced. So creativity is pretty critical for having protecting somebody's earning potential for the future.
Interesting. That's a unique way of looking at it. Thank you for that, Jim. There's another question that came through the chat is all about credentialing and the importance of it. How does it align with the jobs definition or the task that everybody doing? Anybody wants to comment on the credentialing? This is a loaded topic, but I'm going to put it out there and see what you folks say about it. Anyone?
I'll start, and I don't know if this is where this question was going, but I think really getting when you're training folks, you should understand what employers they're likely to ultimately work for if you're doing a workforce training. And so having a good conversation with those employers and asking for honest feedback about what's helpful, what's not, before you build a curriculum, I think is really great. And the more you can kind of engage these employers on the front end, then folks are going to kind of move into those jobs and be hireable on the back end.
Anybody else wants to chime in?
I think that's a great point, Joanne. And I would just add to sort of forcing a bit of that difficult conversation and holding up the mirror and saying, if we are serious about right sizing roles and the talent that we have in the organization against the preparation and job readiness for those individuals, I think looking at the data, looking at the demographics, the makeup of the organization, who are we holding back through opportunities or lack of opportunities, and I think being really intentional with ensuring that we are not only removing those barriers, but also creating the right types of opportunities, whether learning opportunities or roles, to ensure that that we're reducing and eliminating those barriers for them.
Jim, any words on that? Or
I just have sort of a random thought, and that's just yesterday I had a conversation with a friend of mine, And she had reached a really high level in her profession in finance. And when she began her career, there were no women in what she was doing. And she happens to be a Latina woman. And she actually said that the credentialing in finance, because there's an awful lot of exams you can take, and whereas she fought an uphill battle just to get respect in the beginning, because she was able to get credentials and really knock down the exams one after the other, where all the men that she was working with were not doing the same thing. It actually opened up a lot of opportunities for us. So I think that there's a good story to tell there, particularly in it seems to be in finance, where there are so many different exams that you can take to get credentials that are meaningful in that area. And that was a story where it helped somebody tremendously.
We've got about 5 minutes, so I'm gonna try and squeeze another question here. So to get a quick answer from you folks on the, earlier on, we talked about the use of technology, and Jessica, you mentioned about the technology as well. I think Joanne and all of us, we're really on agreement that technology can be a enabler, a huge enabler. We've seen what happened during the pandemic, but also could be a barrier, right? For folks that don't have access to it. I mean, not everybody has access to internet. We all know that. Those are the issues. So can you comment on what you're seeing in your particular area, and what are you doing, some of the stuff they're doing maybe to not make sure that access to digital doesn't become the sort of the differentiator, if you will? Anyone?
I'll just say I've been in a lot of rooms where we've started talking about digital equity, and we talk about 3 legs on the stool. So one is, have you got the internet at your home? The other is, do you have a piece of equipment that's reliable? And the third is, do you have the skills to use it? So I think, there's a lot of conversations in public policy around, what's the digital equity we're creating? And, to apply for a job making sandwiches with us or sweeping our floors, you have to go through a computer system. And you're probably going to do, or during the pandemic, you were doing a Zoom interview. So even just getting a foot in the door and into a frontline job requires some access to digital technology. And so how do we support more people with that? And part of that can be done through the workforce system, providing additional support, more access to computers. Some of it's public policy. And then I think as employers, we need to think differently too about, how can we support our employees in this space?
Jessica, do you want to add anything to that?
I just echo Joanne's thoughts too, and I think that's where we have really leaned on community partners that help to build those pipelines in, because similarly, say we were going through a virtual interview process through the pandemic for roles that don't require that on the job. And I think it's not only been evident to us through that process of application and recruitment and getting hired, but most of our onboarding process is conducted online as well. And so we have concierge-like roles that partner with that new hire, because particularly they've been identified, we don't want to frustrate them as they come into the organization and have this slew of online tasks to complete. And so ensuring that they've got that level of support to feel really welcomed and embraced, and that they can move through the necessary elements of their onboarding to be very successful on the job has been important for us too.
Jim, any thought on that? Any final thought on that?
Yeah, I think it's still a problem. And I'm just thinking about during the pandemic, in the area that I was living in Western Massachusetts, where it was very rural, students were having to work remotely. So they were driving to the school or trying to get a ride to the school so they could sit outside and connect to the internet in the school, because they didn't have it at home. And that was a particular problem in rural areas. I would say that there are segments of groups of people where it's definitely a problem not having digital access. There are actually worse problems. Not having a place to study is a problem. Not having a safe environment or the right food to eat are bigger problems than that for a lot of people, particularly on the lower end of the income scale. But certainly digital access and aptitude or skill level is a prerequisite in many cases.
Well said. Well said. Well, this has been definitely been a great discussion. I wish we had more time here, but I want to thank my panelists for a lively discussion and the audience for their participation. We're going to go on a short break and we'll be back at 4:05 for the keynote speaker session. Again, thank you very much, my panelists and the audience for participating.
Thank you for that.
Thank you.